Morning, morning, morning. Yes, we're back with another episode, another lovely rider. Today we have Hannah, and she's a very interesting lady, and she told me something that I had to turn on the mic instantaneously to hear. We're talking about tobacco industry and her dissertation and things like that. So before we roll into that, tell us a bit about yourself, Hannah. What were you studying at uni and why?
I was studying politics a very long time ago, so I left uni over 20 years ago. But I was studying politics. I did it because I was interested in it. I loved doing history at school, and I was probably quite an opinionated 18-year-old, so I thought politics was something interesting to be studying.
Okay, so you did your dissertation on politics.
Mm-hmm.
And what was the findings of your dissertation?
Well, so my degree was politics, but my dissertation, we could pick anything. And I came across this really interesting book in the library at uni around the tobacco industry and the power of lobbying. And basically it kind of posed a question to me, which was, in the 60s was the first time that it was medically proven that there was a link between smoking and cancer. So up until then, there was, it was people thought so, but it was like 1966. It was in the 60s, don't quote me on the exact year now, I'm trying to remember. But that was when they actually showed the link between cigarettes and cancer. So I kind of posed the question that did the government have an obligation to act? So should they ban smoking at that point? So I was looking at wealth versus health, and I came across this really interesting paper that the government did. So civil service put together this paper in about 1984-85 where they looked at the implications of banning smoking in the UK and what would that do. And at that time, the income from tax on cigarettes in the UK, that amount of money was the budget of the NHS. So basically, cigarette tax paid for the whole NHS health service. Now, you could absolutely rightly argue that a lot of the illnesses in the NHS were caused from smoking, but obviously there's a huge amount of other things, and it was paying for the whole budget. They also did some analysis where they looked at, if we ban smoking, how much longer would the population live? And they realised that they hadn't budgeted for people's pensions, and they hadn't budgeted for healthcare for an increased population of older people. They were expecting a certain number of people to die because of the causes of smoking, so they didn't ban it. So it wasn't until, I think it was the year 2000, or early 2004-05, that it was, Europe banned it before the UK, didn't they? So it was around sort of 2005 that we banned it in the UK. It was really under a lot of social pressure rather than the government deciding that was the right thing to do.
Now, what do you think about that findings? What's your personal thoughts on that?
Well, I'm sort of where I sit. I do think a lot of services and things should be centralised and the government should make decisions. But I do think that there is an element of freedom of choice. So I think where we are right now is how it should be, in terms of people can choose to, they should be educated around smoking, but they can choose to smoke. But the fact that it's banned in public places and other people are sort of protected from having to be around, cigarette smoke, before it wasn't a choice. So I do agree with that, but I do think the government should have made a decision that, just because the sums didn't work out was not a reason to make that call. I think back in the 80s they should have put not a ban on all cigarettes, but they should have started to limit and restrict and educate the public on the implications of tobacco and cigarette smoke. Instead, you look at all the advertising and the glamorization of cigarettes, and they did nothing to stop that, knowing full well the health implications of smoking. What do you think, Simon? You've obviously a man with an opinion.
Yeah, I have an opinion. I'm going to roll on. I'm going to come back to your question there, but what I'm going to ask you about is vapes.
Yeah.
Because vapes is the new smoking for young people.
Yeah.
Do you know if the young people have been informed about vapes and what the circumstances are, being a lady of politics?
Well, I'm not really a lady of politics anymore, but I have a lot of friends who vape, and it's interesting because I have a lot of friends who vape who are, educated in their, kind of around in their 40s, and they know that it's highly addictive, and they also know that there are actually, then they're not healthy, as it were. They're not, I believe they're better than smoking a cigarette.
Well, I heard the alternative.
Well, I think it's
actually worse because it goes directly in, does something with your lungs. But
I think this is the thing, is that there isn't enough trial data or implications of vapes because they're still relatively new in terms of knowing what the longer term implications of vaping is. Mm-hmm. So a lot of, typical cigarettes, a lot of the kind of tar and, actually a lot of the kind of things that were put in tobacco have been taken out. So to smoke a cigarette now versus smoke a cigarette 30 years ago, they're actually a lot better than they were.
So they're not spiked anymore.
Well, I think I don't know quite. Don't quote me on that, if that's quite true. But I think that if you're comparing a cigarette now with a cigarette from the 1980s, they have been cleaned up a lot in terms of like the tar and the kind of other things that used to get added to them. But I don't know enough about what actually goes into vapes. But I think the fact that there's no data around the long-term implications of vaping, and that's concerning, because they shouldn't be sort of promoted as a sort of healthier alternative to smoking if there's no data to actually prove that.
Yeah, that's true. With going back to your question, because my big thing is, before I get into that, if the government was really serious about healthcare and reduce the NHS, I see the problem as the public. And when I say the problem as the public, it's people don't want to be healthy. People want to do what they want to do.
Yeah.
And they want the government to pick up the tab, or the other population, the general public, to pick up the tab. So the way you solve that is, in schools you make physical education compulsory every day. Do you see what I mean?
Yeah.
And it's a proper session. It's not like my daughter tells me, we just walk around the playground where the boys play football. No. You're running, you're jumping. Every school has an athletic ground, that kind of thing. And you'd also have to give the school kids free dinners in the morning and the lunchtime. Reason being, it will reduce the amount of social services issues. Do you see what I mean? But you're also expecting them to think. So by 16 years' time, you're going to have these generation of children who are used to exercising every day. And what's going to happen subsequently? The healthcare issue is going to plummet on the NHS. The old people who don't want to exercise, they're going to die out sooner or later. Do you know what I mean? But the new generations are going to be,
But I don't disagree with that. But do you not think that a big problem about the NHS is there's a lot of people who waste the services? And how would you tackle that?
Well, you can't waste the services so easily if you're fit.
Yes, but I think there's a lot of people that kind of cancel appointments, don't turn up for things, don't use their prescription fully, don't adhere to services. There's a huge amount. So I also worked in pharmaceuticals for 7 years. Yeah. So there's a big cost on the NHS around wastage. And I've got a lot of friends who are GPs, who are doctors, who get kind of treated almost like counselling service, not in the sense that for proper counselling service, but they get a lot of people who time waste.
Yeah, who go there just to have a chit chat.
Yeah, they're lonely, which is a whole different thing. So don't get me wrong, it's not that I think that people should be supported in that sense. But do you think that in other European countries where people have to part pay or pay a small contribution, people then respect the services more?
I don't think it's about part paying. I think it's about for some of those things you mentioned, you could easily have you're having to pay this fee now, a fine. It could be dependent, whatever amount, you're going to pay something because you didn't turn up in that respect. But then I will say, like, I had an issue where I tore the adapter the other day, a while ago now, and what I found was I was getting letters from the hospital to turn up to appointments that I'd already been to the day before. So in that case, I'd have been paying fines, even though I'd done their admin was wrong.
Yeah.
Do you see what I mean?
Yeah, yeah.
But those things can be sorted out. I do agree that I'll break it down. The people who are lonely, you need to tell them, be straight and honest with them, and just say, "Guy, your problem is you're lonely. I suggest you go on Tinder or you go to an old people's social club or whatever, and find a friend. That kind of, get a dog, get a cat, whatever works for you. Do something, but stop coming here." Do you see what I mean?
Yeah.
Because I've spoken to GPs, I've interviewed GPs who said the patient who used to call every day and demand 20 minutes of his time, and because of the legal parameters within the NHS, he couldn't just tell her no. And the admin staff at the general practice used to say, "Oh, it's your wife on the phone." That's how common the woman called in that respect. But overall, I don't think you should charge for the healthcare. But I think you should be responsible.
Yeah, I just I love the NHS, but what scares me, is, I just had my first child 2 years ago, and we'd like to have a second. And the thought of I know that our local hospital where I had my daughter 2 years ago, they've had to close like half the maternity ward because they don't have enough staff, and that does you feel very vulnerable. The thought of going into labour. And there not being enough staff and resources to help you in a moment where,
my brother
you need it. It sort of makes me concerned.
I just got off the phone to my brother about an hour ago, and he delivered his own baby in his car.
Yeah.
And he's in the hospital in the car park. He couldn't make it. I said, he's a better man than me.
Well, congratulations.
Yeah, I know what you're saying, because he's shouting help, but he said no one was coming.
Yeah.
Yeah, and all those kind of things. I do see what you're saying there.
I'm not saying that necessarily part payment is the answer, but I think that there is a lack of respect for the NHS.
There has to be a consequence.
Yes, I think increasing fitness and health, but I also think that there has to be, how do you make people more accountable? And ultimately, if you look at anything else in our lives, when people have to, how much fuel, am I going to have the heating, if it's free, I'm going to have the heating blasting every 2 seconds. If I'm having to pay for part of my heating, I'm going to be a little bit more kind of, more choice in when I'm going to put the heating on. So I'm not saying that have everyone having to pay for healthcare is necessarily the answer, but there just feels to me like there's a lack of respect for the services.
I would say that comes down to education, as in how you're taught at school, if you see what I mean.
Yeah.
So it's like if you're taught about the environment, the younger generation will care about the environment a lot more than the previous generation because of the way they're educated. It's one of those things in that respect. You definitely need consequences and accountability. But I will say this, I interviewed a guy who's a type 1 diabetic, and his brother had a hole in his heart and he died. His brother came down and just said to his mum, "I don't think I'm going to live, I think I'm going to die today. I can't even put my trousers on." And his mum said, "Don't be silly." And she helped him into a comfortable position, then he just died within the hour. But he was meant to only live to 16, so he lived to 21. Now, they could have sewed up the patch on his heart, for whatever bit of reason, hospitals make a decision about what they're willing to pay for and what they're not willing to pay for.
So they have what they do in the NHS is that there is, well, not so much the NHS, but a body called NICE, which looks at treatments and cancer, and they look at cost per quality of life. So they look at the cost of surgeries, treatments, drugs, and they look at how much it's going to cost the NHS essentially to do that versus and there's like a whole kind of calculation versus the improvement in the quality and length of life. So, if we do this surgery and spend all this money and it's going to cause you to live an extra year or two, is that worth it versus us being able to therefore afford to be able to instead do 10 of these types of surgery and increase the life expectancy of 10 other people by 10 or 15 years. They're constantly having to make those calculations and weigh up, because there's a finite budget, so they weigh up what treatments. I'm not, that instance I have no idea of, but they constantly have to make those decisions around what's funded.
But what I was saying is that regarding the guy who's diabetic, he has to pay for his insulin every week. He has to pay for, he's got this thing in his arm that he pays for, and he's got these other things that go with the thing in his arm that read in his blood sugar. But he pays for that. But then you'll get somebody else who would say, let's say I'm in the wrong body and I want an operation and I need done free.
Yeah.
And you're like, that doesn't quite add up to me.
I don't know why he has to pay for insulin. That surprises me, because I'd have thought that was...
Yeah, because I class as a type 2.
Yeah.
And I have a card and I'm meant to get it all free. But he has this thing in his arm that reads your blood pressure.
Okay.
Read your blood sugar, and you scan it on the phone like there, and then it tells you what your blood sugar is. So it's a constant metal thing in your arm.
Right.
I'm not sure if I'd want that.
I think if you're type 1, it's, rather than having to do tests rather than having to sort of sample your blood every day,
Yeah, it's probably easier just to
take a measurement.
Yeah, in that respect. So when you were doing your degree, apart from that finding about NHS, what was the biggest surprise? And I also want to ask you is, has that changed now in this modern society? I don't know how up to speed on facts and figures you are, but is it the case that the NHS smoking can still cover all the NHS costs?
No, not anymore, because the tax is much higher on cigarettes than it was in 1985 as a proportion of the cigarette and everything as well. But there's a lot less people smoking, and the NHS budget is a lot higher, so doesn't cover it in its entirety anymore. I don't know the accurate numbers, but I do know that.
But what is interesting, and I go by like Tinder analytics, so Tinder data on this, a lot of people who do smoke are foreigners, as in they're born elsewhere and they've come to live in England. A lot of the British born, because of the education system, they don't. So London's got a lot of immigrants. So maybe there's still a lot of people who do smoke, we just don't realise, depending on who we mix with.
Yeah.
Just thought I'd throw that out there.
Well, I think there's also a lot of people that, well, I think it's, the underground market, as it were, for cigarettes, and I just, in terms of people bringing cigarettes from abroad or cheaper cigarettes because it's so highly taxed here. I don't think that, yes, there's probably more smokers than there's sort of income from cigarettes, that if you're doing the sums in that way.
Yeah, I hear you. So about all this back routes I'm having to take, I'm trying to avoid the big traffic.
No, thank you.
If you could do your degree again, would you still do the same degree, and why?
I really enjoyed it because I chose to do a politics degree. I went to Leeds Uni, and one of the reasons I chose to do my degree there was that there are some sort of traditional kind of red brick universities. So sort of Bristol's a good example, and there's some in London.
What's red brick?
So they're very kind of, the way that they do their education package is very traditional, essentially. Whereas, so you do a lot of kind of political theory. Whereas in Leeds, what I liked about the degree up there was that a third of it was political theory and studying, like, European Parliament structure, and you slightly felt very schooly tick box things. Whereas they also did really cool additional modules that you could sign up for, which I loved. So I did a module on corruption in Africa. So we had someone that talked us through, we learned about a lot of the political systems in Africa and how that worked. I did one on the oligarchs in Russia, and we actually studied, we had a guy that worked part-time in London for a consultancy that advised businesses who were investing into Russia about the political system in Russia and how they should make things happen, essentially. And we studied Russia as we watched Putin elections. So it was great because it was topical rather than just political theory and looking back in time. It was looking at what was currently happening. So we did terrorism.
When you looked at terrorism, did you look at terrorism overall, or did you take a specific region?
Yeah, so we looked at specific topics, but in the main it was we looked at different conflicts, and then actually how those conflicts, because it's making me think back to 20 odd years ago what I was studying on different ones. We looked at Israel-Palestine as an example, and then we looked at how terrorism became almost a weapon for Palestinians to be able to, because they didn't have the kind of the military power of Israel. So actually what was classed as terrorism, how you might view that differently if you understand background to the Israel-Palestinian conflict, how you might look at it through a different lens rather than see a suicide bomber. You might actually think about the powerlessness of one side versus the other, and why people might act, and just taking a more open view. I really enjoyed it. It made me, I was brought up in the southwest of the UK. I went to an all-girls school. I was probably quite insulin protected in my upbringing, and it at least started to make me question things and think. And I think that was a really good age for me, aged 18. I also met lots of different people, and it just opened my eyes a little bit more to the world. I would do the degree again. There's nothing else that I'd actually rather have done. but it also taught me good skills going into any career, I think, from a kind of business point of view, because it teaches you to look at lots of different information and quickly sort of disseminate that into a point of view and being able to sort of put across your perspective. So it was a good sort of training into being able to sort of phrase or put across the information that you want in a succinct manner.
Your degree sounds like something you do before you go and work in a Foreign Office.
Well, I think a lot of people do it before they go into civil service. It's quite a normal thing that a lot of people go and study politics and then choose to go into civil service. I actually did. There's the civil service at that time, it probably still has it, had a online quiz that you could do on the civil service website where it's like, is the civil service the right career for you? And I did this quiz and it basically gave you loads of different scenarios and you picked what you would ABC. What would you do? And I remember there was quite a few scenarios where it's just like you're working in the waste and water management team or whatever, and you've had to do a whole project on a new drainage system across a major city in the UK, and you've presented this to your local MP or to the minister, but they've decided that actually they don't want to go with what you've advised. They want to do something different because it sort of makes sense for them politically. They're aligned to something else. What do? Do you keep quiet? Do you go to your boss? Do you push your point forward? And basically the correct answer is you keep quiet. Like, that's your job. Your job is to put all the information together, present it to the politicians for them to decide what they're going to do. And I was, my answers were all a bit like, well, if they're wrong, I'm going to tell them still why I think this is the right thing to do and this is, the best benefit. And it was, the end result was, Hannah, you are not suitable for a career in the civil service. I was too opinionated.
No, they want yes men.
They want people to do from at that time they wanted the people to do the work, present it in the correct way, but it's not if you're in the civil service, it's not your call to ultimately make the decision. That's what the politicians have been
hierarchical.
So I was told it wasn't the right thing for me.
That's very interesting. We hope that episode enhanced your life. We post an interview every day as well as vlogging on our social media channels. Don't forget to subscribe to get our latest episode.